Foundation, chers facilitateurs de bois marchand, chers partenaires communautaires de Barclay, Montgalcan et Solitude, dear friends of the press, dear guests, I'm very proud to welcome you to this event as chairman of the board of the Fondation Joseph Lagesse. For the past 12 years, the foundation has been active, working closely with the communities to alleviate poverty and all its side consequences, such as substance abuse. The project we are launching today, in collaboration with CADCA, will allow the building of community platforms, a concept we have applied successfully and in which we strongly believe. I warmly welcome to Mauritius and to the IBL group our two trainers from CADCA, Dr. Eduardo Hernandez and Mrs. Abby Vians. I will now give the floor to Martin Anquin, our energetic director of the foundation, for a detailed description of our community project. Thank you.
Thank you, Mr. Lagesse. Ms. Abby Vians and Dr. Eduardo Hernandez from CADCA. Dear community partners, chers facilitateurs de bois marchand, dear members of the press, dear colleagues from IBL and the Fondation Joseph Lagesse team, and dear guests, it's a great pleasure for us to launch today this innovative community development project in drug use prevention with the help of Community Anti-Drug Coalitions of America, represented here by Ms. Abby Vians and Dr. Eduardo Hernandez. Since 2016 at Fondation Joseph Lagesse, we have set up a department of community development, and we work very hard since to engage with the community, especially at Bois Marchand. This initiative resulted in this wonderful collaboration with CADCA, thanks to the intervention of the International Narcotics Law Enforcement Bureau at the Department of State, represented by Mr. Brian Morales. Mr. Morales added Mauritius on the list of countries receiving technical assistance from CADCA for coalition building to tackle drug use and its social and economic consequences. We are extremely thankful and honored, as it is a unique opportunity to benefit from the expertise of the prestigious international NGO, CADCA, in the field of drug prevention using a community-based model. Working with and in the community is what Fondation Joseph Lagesse has been practicing since its creation in 2005. We have developed close relationships with the community and maintained them throughout the challenges we meet over the years. It is precisely this relationship, in the long run, that has earned Fondation Joseph Lagesse its trust and respect from partners and stakeholders. Today, community development is taking a step forward in empowering 4 communities through this program of training in drug prevention, using both individual and environmental strategies and addressing 12 sectors of the community. Representatives from education, local authorities, health, parents, youth, religious organizations, small businesses, drug treatment organizations, etc., will all be around the table to take a close look at their community and be creative about the interventions that should be put into place for their community. This is how this initiative will promote empowerment, respect, and dignity for the members of the community. Abby and Eduardo, welcome to Mauritius. Thank you for your commitment and presence among us this week. We hope that your stay and contact with community members will be enriching, meaningful, and bring along the changes that we all want to see in underserved neighborhoods in Mauritius. We wish you all a fruitful training session and a special word for community members that are present today. Bienvenue aux facilitateurs de Bois Marchand et merci pour votre présence ici à IBL. Je connais qu'il y a un gros travail de préparation qu'il fait avant qu'il s'approse et là, qu'il réussit à mettre en place. Félicitations pour votre engagement. Tous les mercredis soirs et dimanche matin pour formation. Nous sommes bien contents qu'ils soient parmi nous aujourd'hui pour ce projet 4K. Profite bien de l'expérience. Pas tous les jours qui nous gagnent, nous sortis depuis l'Amérique pour venir partager notre expérience avec nous. Et pas hésiter à participer, causer, partager votre idée pour notre communauté. Ensemble, nous sommes capables de beaucoup de défis dans la vie à nous faire aujourd'hui. Thank you to Violetta and Nicola, my colleagues from Community Development Department. Where are they? Yeah. Thank you to Nicola and Violetta for their involvement in this project, and also to all FGS team for the tremendous preparation work for this week. Merci beaucoup. Thank you very much.
Well, let's see here. Okay. Good afternoon. My name is Eduardo Hernandez. I'm a consultant with Community Anti-Drug Coalitions America, CADCA, which is based in Alexandria, Virginia, very close to our nation's capital. I have worked in the area of substance abuse prevention for over 25 years. Even though I'm only 35 years old, I did it for 25 years in the United States and in many countries in Latin America, Asia, and Africa. And one question that I'm always asked is, how can CADCA work in these different countries? And the answer is always the same. We could not do this work without strong collaboration with organizations like the Fondation Joseph Lagesse. And I want to thank you in name of CADCA for the partenariat que nous avons avec vous, because without that, it would not be possible. It would not be possible. We can't go around. We're not experts in Mauritius. We're experts in building community coalitions. But you are the people who are experts avec votre engagement, avec votre expertise, avec votre expérience dans la communauté comme bon marchand. Et je vois le facilitateur ici, bienvenue. J'étais ici en décembre.
Yes.
Et nous avons fait visite, 3 visites à bon marchand. Et j'ai resté très impressionné avec votre travail. Félicitations. So, just quickly, I'm going to talk briefly about what is CADCA, why are we here, and then I'm going to turn it over to my colleague, Madame Abe Vianès, who's worked not only in the United States, but is currently assisting CADCA in Togo in West Africa, in Senegal in West Africa. She just came from training over there and will continue to work and will be working here with us over the period of the next couple of years. So just quickly, I just want to say, and this is in French, so you can read it better than I can, but CADCA was founded in 1992, so we've been around. We're the largest organization in the United States, the largest organization in the United States working on prevention issues, okay? We are NGO, independent. I don't work with the U.S. government, any government, neither does Madame Vianès. We are NGO, independent, nonpartisan, and we work on alcohol, tobacco, and other drugs. So, particularly in some of the countries that we work in, we find that the major problem is children consuming alcohol. So, we address the problems that the community surfaces to us. We work with over 5,000 community coalitions in the United States, and actually I think that is now étranger, it's 21 pays. They just added another one, right? Mm-hmm. And yeah, it's 21. And we work with community coalitions, which we'll talk about in a second, to help them develop their capacity. This is a bottom-up approach. It's not a top-down, but bottom-up approach, for which community members, like these people back here, will be working to identify, to resolve their own community problems with our technical assistance, okay? So, just quickly, what do we do? We have politique publique aux États-Unis, right? Nous faisons des politiques publiques à favor de la prévention, de l'allocation de ressources à la prévention, à ressources à la communauté. Nous faisons des formations, assistance technique, la diffusion de la recherche. Vous savez qu'aux États-Unis, on dit qu'aux États-Unis, il fait 85% de la recherche dans le monde entier de la question de drogue est faite aux États-Unis. Que nous avons de grands instituts là qui font ça. Mais qui lit tous ces journaux? Hein? Personne. Personne. Moi-même, I don't read those journals, but we translate it so people will know. And Mrs. Vianez, for example, has read and worked a lot with the latest research on brain development with adolescents and the consequences that we have there. So that's important to know what the research is telling us. The media is an important. And when I talk about media, it's important that we now have this is television, Maurice and Ion News, I see, and that's good. But we also know that the adolescents, how do they communicate? With social media. And we also look to have a social media presence when we're talking about the adolescents. I want to say that when we talk about prevention, we really are talking about children and youth and adolescents, right? That's really who our target populations are. We do special events and we do programs, and we have an international program, right? And you can see a picture of the work that we're doing in Manila, and I think you met some of the people working in the Philippines. I can tell you they have gone so well in the Philippines now that they have a association de coalitions there.
Right.
Okay? Let's see here. Oh.
There you go.
Okay. So our international program, which was mentioned, is resourced by our Department of State in the United States, provides us with the ability to travel around the world and to work with communities. CADCA is not here to provide technical assistance to the government of Mauritius. CADCA is here to work with communities and organizations like the Fondation Joseph Lagesse. That's critical to our mission, to work with NGOs, in this case a fondation, with communities. That's what we are supposed to do. And we have been doing this. I started this in 2005 in Peru, in Latin America, in Asia, Central Asia, and now in Africa. And as you can see, I don't know if you're in there, but there's one in Ghana, and then there's one in Honduras, where we look at very different problems. Okay? Oh, and we have a map of the countries that we have currently been working in. As you can see, we started off mainly in American Latin, but we are working now in West Africa, and now here in Maurice, in this part of the world here, okay? It has really been a very successful initiative. Well, I am very pleased to also say that CADCA is doté de statut consultatif spécial au Conseil économique des Nations Unies. We accomplished this several years ago. This gives us an international forum, and when our work in the United Nations, what we do is we always advocate for prevention, and we always advocate for the role of civil society, foundations, organizations like us within the whole complex, right? The importance of civil society that does the work of prevention, that does the work of substance abuse treatment. And I think the situation here is the same. Now, I'm going to ask Mrs. Vianez to talk a little bit about what do you mean by community, if you want I can do this for you.
Okay.
Community coalitions.
A community-based coalition is essentially a group of volunteers who come together with an agreement to work together on the same issue or same outcome goal. They come from different sector or different areas and groups in the community, and I will show you those in just a minute. But we know from over 20 years and over 5,000 coalitions that CADCA has helped install around the world that it is a very effective approach to lower substance abuse rates in communities that have these coalitions. Okay. So these are the key sectors that we require representation on the coalition. Some places have added another one. In Senegal, they added one for women-directed organizations. But we really know that each community needs to have young people, parents, merchants, media. The media is critical. The media is your good friend because they are the ones that get out the word to what you're doing and spread the word. Both public and private education representatives, nonprofits that serve young people, your law enforcement, your religious and fraternal organizations, also your civic organizations, and your government sector is very, very important. We, on the coalition that I directed, we had local and state level government representatives. Your professionals who work in health, could be mental health, it could be in treatment, it could be in family health. It's very important to have your professionnels de santé. And then also, we always have les ONG who are working against substance abuse disorders, not toxicomania.
Yep.
So, we use evidence-based strategies. A community-based coalition will have two parallel works to do. One is the job of creating and maintaining a community-based coalition. There's a whole set of skill sets to do that. And the second is science-based, evidence-based, research-based strategies for prevention. Because not everything works, and some things can actually cause harm. So we teach the coalitions which initiatives have the best outcomes. So if you look here, we have 7 strategies that change behavior. If we don't change behavior, we're not going to get a good outcome. So the first 3 are directed towards individuals. So giving out information, creating public awareness, educating parents, because parents are the first line of defense in a child's life, protective defense. We reinforce competencies, and we give social soutien social. And then the last 4 are more environmental strategies, and these are strategies that affect a larger group of people. So if we can reduce obstacles and create better access, when we change consequences, such as penalties, or even go the other route and give incitation, that really works. When we modify the physical concept of the environment, just for a quick example, if you have une fête foraine or some kind of festival, the area that is serving alcohol would be off limits to children, and that would be barricaded off. So that would modify the conception, la conception physique, and it would also, it would change l'accès. And the last one is modifier la politique et les règles.
Yeah.
And you'd be surprised what coalitions can do over time. And if you change in politique a policy or a law, then you have affected change at population level. And everyone is covered. So the last 4, you're going to reach more people in your population.
In fact, I'll just quickly mention, CADCA is an NGO. We're not a university, we're not a research institution, but we work closely with universities. So this, what Ms. Vianès has just given you, is not CADCA's design. It says right there that comes from the University of Kansas Work Group on Community Health and Development. That is an organization affiliated with the World Health Organization. They're the ones, it was the professors that came, the researchers that came to us and said, here's what evidence shows is effective. That's important to us, okay? I'm not gonna waste my time with things that are not effective. And again, excuse me for interrupting, but it's important to say that this is research, long-term research, 10 years worth of research that shows that what she just mentioned is effective. And if you want to think about an area of effectiveness, I usually say, look at what has happened in our lifetimes. Oh, vous êtes jeune. What's happening in our lifetime with tobacco, right? When I was a young man doing studies, she laughs, she says, il est vieux, il est jeune. When I was a young man at the university in Los Angeles, California, tout le monde fumait. Tout le monde fumait. Même les professeurs fumaient. Et maintenant, ce n'est pas possible, hein? Qu'est-ce qu'il a changé? Il a fait une modification de la politique et la règle. Right? And we've seen this. It works.
Yes, you can Google Kansas, K-I-N-S-I-S, University Toolbox.
It's there.
And you'll see all of that research. You know, it's interesting to note that the first movement against workplace smoking was initiated by airline stewardesses. There's a test there.
Yeah. I think you have one more here. Et finalement?
So here we are. I have trained with CADCA now, this is the 7th year, and I've had 15 years in prevention in my particular state. Thank you.
I think we'll take questions, si vous avez des questions, par les journalistes à nos amis de CADCA.
What's the objective of Fondation Joseph Lagesse in this sense?
L'objectif, c'est l'empowerment communautaire, c'est-à-dire de transmettre cette valeur qui est que les personnes qui sont au cœur de la communauté savent ce qu'il faut pour leur communauté et sont les acteurs principaux des interventions à mettre en place pour leur communauté.
Donc, combien de fonds que vous allez mettre à disposition de ces communautés?
Alors, nous avons la chance justement de bénéficier de ce programme qui est financé par le Department of State des États-Unis.
À quelle hauteur? On peut avoir une idée?
Je n'ai pas accès à cette information. Je sais que nous bénéficions de l'assistance technique du CADCA, mais je n'ai pas accès au coût du programme qui est pris en charge par le Department of State.
What would you like to change? You have visited Bois-Marchand elsewhere. What would you like to change?
I think that what we'd like to change is the community's ability to address and resolve its own problems. And this community, I am convinced, in Bois-Marchand and the other communities, has the ability to do this. What they lack is the resources and the research that we can provide, as was mentioned, in partnership with the foundation and whatever else. No government, the Mauritian government, the American government, the French, no government can resolve all these problems. Really, they can't. And community members have the ability, really to, and this, I know that the foundation is working on this, the empowerment to look at their own problems and see how they can address them. They've already done this. In the last time I was in Bois-Marchand in December, they were talking to me at community cleaning. They're already starting to do this. We would like to accelerate that process, have it more focused, right? And at the end, the goal is to reduce the level of substance abuse. That's a goal.
Est-ce qu'il y a d'autres endroits que vous aimeriez mettre le programme? Bon, on a parlé de Bois-Marchand, Berkeley, c'est communautairement, je vais rentrer dans ce débat, mais pourquoi vous avez choisi ces deux endroits-là?
Alors, ce n'est pas vraiment un choix, c'est-à-dire que l'idée était de commencer avec là où la Fondation est présente, c'est-à-dire la Fondation est très présente au cœur de Bois-Marchand depuis 8 ans, ou presque 10 maintenant. Ensuite, était d'étendre le programme pour impacter le plus de personnes possible et le plus de communautés possible. Et nous savons, de par l'expérience que nous avons sur le terrain, que Morgalcan et Barclay, et aussi Solitude, avec qui nous travaillons beaucoup à travers Caritas, que ce sont des localités actives au niveau communautaire. Okay, ce sont des localités qui ont déjà un historique de l'empowerment communautaire et de mobiliser la communauté autour d'un projet commun. Donc c'est comme ça que le choix s'est fait. Nous espérons que ça pourrait, ce modèle-là pourrait se répéter. Pour l'instant, c'est un modèle, c'est un projet pilote qui va demander justement l'intervention de CADCA 3 fois par an pour compléter le programme de 12 modules. Et nous espérons que cela va donner, ça va faire des petits en fait, que ça va permettre la création de plusieurs plateformes communautaires.
If I could just say quickly, you know, this is a pilot project. A pilot project. Yeah, Projet pilote, c'est ça. To start with these 4 communities and this training. This is the first time we've done this. This is going to need to be modified. But I can tell you, in my experience, when other communities see this, oftentimes they want to adapt the same strategy. For example, in Peru, Lima, I started in Peru. Imagine cocaine, products of coca production everywhere. I started in 6 communities in 2005. When I left in 2010, there was over 50. I didn't do that. I didn't start all those communities. The community members themselves came and said, we want to do the same strategy. And the people that I started training turned out to be the trainers for the other communities, right? So what we want to see is a continued mobilization growth of this, right? But with our resources that the State Department provides us, we can only do a certain amount, right? There's no cost to the participants. There's no cost to the foundation. You know, this is resources that we have that have come to us from our. I don't know if that's clear. But tell me if it's not.
Une dernière question. Ok, écoutez, je vous remercie de votre présence. Et je suis toute la presse et j'espère que vous ferez une bonne ouverture de la présence de CADCA et de tout notre travail avec la Fondation. Merci.